We are ready.
Okay. Good evening and welcome to the amazing talk by the interns on their experiences. This is run by the Wits Students Pathology Society, and we're proud to welcome 7 of the different interns that we have contacted. Most of them are from Wits, but we have 2 people who are also from Bloemfontein, which means that we've got some people with all sorts of different experiences. We have interns from all over the country, and how this evening will run is that we will just have each person introducing themselves and saying where they are doing their internship and just a little bit about themselves if they want to. If not, that's also fine. And then we will go through all of the questions that you guys have submitted to ask the interns, and then we'll get through as many as we can. And then at the end, we will be doing a raffle for the Pat Sock Scrubs. So I think we can begin. Lamisa, can you take it away? Are you muted still?
I was muted. Sorry. Thank you so much, Sophie, for that introduction. So I think, as Sophie said, we can just quickly go around. Everyone can just introduce themselves and tell us which hospital they're working at, and maybe give us a short pros and cons of the place that they're working at. Maybe Cecile, if we can start with you and then go around, if that's okay.
Yeah. Sure. So I graduated at Wits last year, and I'm currently in my center. Flirt is good. It's great. It's like very cool. Hunt is the thing is you are very super specialized. So
I'm not sure if it's just on my side, but I'm struggling a bit with Cecile's connection, so maybe we can just move on. Francis, if you want to carry on, and then we can hopefully catch Cecile a bit later.
Okay, cool. So my name is Francis. I also graduated from Wits last year, and I'm currently an intern at Barra. I'm currently in my internal medicine rotation. Pros of Barra, you always have a lot of support. There's a lot of people always around to help you. You never feel like you're on your own. Cons, it's a very big hospital and there's a lot of patients and you're busy all the time. And you end up sacrificing a lot of yourself to your job, but it can be very rewarding. So, yeah.
Yashka, if you'd like to go next.
Okay, hi, I'm Yashka. I am at Pietermaritzburg Complex, which is made up of 3 different hospitals. And for your internship, you rotate through all 3 of them. One is a rural, one is tertiary, and one is a district/regional. So the pros of that for me is that you don't stay in one place and you also get to experience different levels of medicine in the same rotation. The cons of it, there's quite a few. A lot of it is the KZN healthcare system, which most of the time was.
Sometimes very much alone. It's a very small hospital with 20-something first-year interns, and I started the year with internal medicine, and first call, you're completely on your own. No second on call, no medical officer, nothing. You can phone someone at home, but you're covering the entire internal medicine department other than COVID for the night. And it's extremely overwhelming at first, but it's something that really, really makes you grow very fast. And everyone knows everyone at the hospital. The Western Cape healthcare system completely blew me away. Everything works. Porters are an extremely efficient thing. Bloods get sent away in tubes in the wall, and it's just everything is so efficient. Coming from Gauteng, I just didn't know what's happened. So I really am living a luxurious life at my hospital. Thank you.
Yeah, that's really interesting to see the comparison between Joburg, Pietermaritzburg, and Paarl in the Western Cape. It just sounds very, very different. If you can hear us, we're just doing quick introductions of who everyone is, which hospital they work at, and a short list of pros and cons of the place that they're working at.
Cool, yeah. Hi, everyone. Sorry for being late. But, yeah, I'm Falak, and I work at Barra. Pros, I get to live at home, which I know sounds really lame for some people, but, I guess you can't see me. Can you see me now? There we go. Okay. Cons, you work really, really, really hard. And sometimes I think the reward doesn't really match up to how much work you put into it. But yeah.
Thank you so much for that. Jovi gave us a bit of insight into working in the Western Cape, and Yashka a bit on Pietermaritzburg. But in terms of, looking beyond the hospital that you're working at, what is the different experiences that you encountered in moving provinces? If you were from there originally, or just from moving versus studying at Wits in Joburg to a different province, what was that like? Joey or Yashka, whoever is keen to answer this one.
Yashka, you can go first.
Okay, so I am from Johannesburg, so I actually moved provinces and I'm staying by myself. I think it was quite a daunting experience because truthfully we found out so late where we were placed, and to try and find a place to stay somewhere where you don't know the area at all. I also don't have any family here. It was quite scary, and I made me grow up a little bit, which I think because at first I was at home for those 6 years, so I didn't really transition through that period in my life until I moved for internship. Yeah,
and I think moving is just very expensive. I didn't realize that, and you haven't gotten your first salary by then. But what's nice about internship is that everyone knew where you're going. Well, okay, not everyone, but most people knew where you're going. So you're all in it together, which is really nice. And you're all thrown into the deep end together. And yeah, just getting to experience that to the Western Cape healthcare system was a real treat. It made life much easier. But it's a whole new adjustment compared to and what we have in Gauteng. You're used to the system there, and now you all of a sudden on day one have to learn everything new. That everything's on computer, and still be seeing all your patients and doing everything. So it's an extremely, I think, just overwhelming process in the beginning. And what we did, there's 3 VITCs that are there. So we started a little WhatsApp group, and then we just keep each other going in the first little while. That's really nice. I also social compacted. My social compact person ended up going to George in the end, so that didn't work out. But it was really nice knowing that initially we were going to be together. You feel like you're on this little adventure to another province. And I actually applied to Paul. It was my 3rd choice. First one was George, and then Victoria Hospital, and then Paul. And I do think that social compacting gave us a better chance of getting our top choices. But yeah, I hope I've answered the question.
Yeah, you definitely have. Thank you. Cecile, I completely forgot about you moving from Joburg to Cape Town. Please add to that.
So I think what I really enjoyed is moving to Cape Town. So the thing is, you're so involved at the hospital all the time that it's so nice to be able to go post-school to the beach, or post-school you can do a few things. It feels like you're on holiday once you have the rare weekend off. So I think it's just so nice to be able to go and explore a city that you haven't lived in before, it is very daunting. Like Yashka said, like you grow up quite quickly having to move and having to like take care of you.
I swapped for had I not gotten what I chose. So that was my strategy. I chose what I wanted, and then I chose other things that had I gotten them, A, I would have been fine or semi-okay with them, and B, there were not obscure places that I could swap for if I'd gotten the chance. The downside with that is if they are that popular, you might not get any of your 5 choices. So I'd recommend choosing some, like one that you really want to go to, and the rest need to be places that you can get into, but might not be the most popular. But as you make all of your choices, make sure that you're okay with every single one of them if you end up at them. Because if you just choose something for the sake of choosing it and you end up there, you might be in a lot of trouble. Yeah.
Yashka, would you like to add to that?
Hey, so from what I know also is that we had like contacted the HPCSA and the placement people, I don't know what they're called again, before we applied. But so the one thing, like Joey said, is that social compact helps you a lot, but it restricts your choices to certain priority facilities or things like that, depending on which type of social compact you choose. So although it may increase your chances, it does take away a lot of like the, I think, tertiary facilities. But as Falak mentioned, the way you should do your placement is that since you have to spread it across provinces, the province that you mainly want to get placed in should guide you. And you should pick the most facilities from that province, because most likely, and those should be in your top choices, because most likely then you will get placed there or somewhere close to there. That's been the pattern for most people. So even people who didn't get their first or second choices often then got a place in the same province as their first or second choice if they didn't get placed in their other choices. So that might be also something to consider when you're applying, is ranking your provinces and then choosing facilities in that way.
Thank you so much for that, guys. Francis, if you just have any advice maybe for students in clinical years, 5th and 6th year, and how to better prepare for internship and maybe how to avoid burnout later on, please can you give us any tips?
Sure. So I think it's important to get involved. Like, I know everyone always says that to you, but it's really helpful if you have experienced the things, even if you haven't, like, say, done an LP, if you've at least you've watched interns do LPs and you've seen, like, the process of setting up, or watching a BMAT or watching a CVP. Like, I know in clinical years you often, like, bogged down with tests and, like, case reports and a whole bunch of other stuff. But, you know, when that ends, you are going to land up, you're going to be an intern and you're going to have to do the things that the interns are doing. So you have an opportunity to get, like, a little bit of a taster before, and I would really recommend doing that. And especially if you're looking to apply on the VIT circuit, like if you know you want to apply to Joburg Gen or you know you want to apply to Barra, when you're in rotations in that hospital, become even more involved. Like, last year, I used to go with my interns to book CT scans, and I used to walk with them to, book x-rays. And so you learn, like, where things are and how the process works. And it makes it a lot less daunting then on your first day if your senior says to you, go book this CT scan or go do this LP or whatever. And if you've never done that before, you don't even know where to begin. I think it can be made a lot easier if you have at least had those experiences. And I think, that would be my biggest piece of advice in clinical years, is to just get involved and try and watch what your interns are doing and get involved with that.
Yeah, I definitely think as students, we're often quite intimidated to go head first and try out something ourselves or do something that we're not really comfortable doing. So that's really good advice. Thank you. Joey, would you like to add to
Yeah, I just want to say I agree with Francis in terms of that. And what I've noticed is that with Wits graduates, we're a little bit less practical than other universities, it seems. I've even noticed that Stellenbosch students are doing full night
so it
course
sort
from
of seems fine
year
now,
3
and I think
already.
we'll just
They're already
monitor.
getting such clinical exposure, and I did feel like I was a little bit too, okay, how is this going to really benefit me next year, when I am in the hospitals?
And just kind of a follow-up question on that. Did the training that you expected from the hospital that you chose and the hours kind of influence your decision on where to go? Or as Joey was saying, he knew that he had that training from Barra, but was that any factor into choosing your hospitals? Tinswalo, I'm not sure if we still have you, but would you be able to answer that for us maybe? I think you're still muted, Tinswalo.
Sorry about that. The training we got in Bloem was really, really practical. And I think a lot of the doctors there are quite overworked in certain hospitals. So I knew for sure to not go to somewhere like Barra because you had like such a massive patient load, and I didn't really want that. I wanted more sort of better sort of following the protocols and like learning specific skills to be prepared for ComServe, rather than just sort of working really hard to get patients sorted out in a way, if that makes sense. So I wanted to choose a hospital like Livingston that is like a tertiary hospital where there's a bit more of a balance between how much training you have and how much supervision you have, rather than just getting patients out. So unfortunately, when I got to Uitenhage, it was a different situation where in family medicine for 6 months, we sort of just had to run ED, get patients out, and not really learn that much at all. So I think the training you have at your hospital is important while you're still an undergrad, but you must just be sort of aware of what place you choose in terms of how it's going to impact your further training as an intern in a sense. Does that make sense?
Yes, thank you so much for that.
Yeah, I totally agree with that. I thought I was going to pick Barra because it's an academic hospital, it's super specialized, and I was going to learn a lot. And what Tinswalo said is totally right. I just feel like there's so many patients that I see a lot of patients, but I don't see them fully. I don't learn from them. Whereas if I was at a place where we saw less patients, I may be able to spend more time and learn more academic stuff and more knowledge-based things and procedural from those patients. Whereas now, almost, especially with COVID, every day is it's more about pushing numbers than it is about learning. And you get very good at being efficient and you get very good at doing a lot of things quickly, but I feel like I'm not getting that academic learning experience that I actually came to Barra for. So if that's what you want, I would recommend a less busy, but still maybe regional hospital where someone has the time to teach you, whereas here nobody even has the time to teach you.
Yeah, that's really interesting because I think a lot of students, as you said, think the opposite and think that Barra has a lot of exposure to a lot of different things. So that is very interesting. Cecile?
So I must say, like at Grooteskier, it's very different between the rotations. So I've completed peds, I've completed internal med and obstetrics. So Grooteskier, it's very nice. In peds, we have allocated teaching time, which really, really benefited me because last year of medicine, like we didn't know what was going on. I didn't know what was going on in peds, so I went into it like quite blind. And I think at Grooteskier they really understood that, so they made sure to teach the interns like students, but not like degrade us in a way that like we thought that we didn't know anything. They gave us the respect that we needed, but also the teaching that we needed. But in things like obstetrics, it was also a lot of like patient pushing. So I think at Grooteskier it depends what rotation it is, but luckily it is an academic hospital, and my big thing is there are students there. So it's very nice the consultants teach the students. So you get reminded all the time about things that you did learn in med school, you just forgot about. And then it's less pressure because they don't ask you the questions. So I think that is very nice.
But like, I'm not sure if that's a hand from the previous question.
Oh, it probably is. Did I not?
Okay, no problem. Yashka?
So I just like to add on this point because this was something that was quite important to me when I was applying, because I really love learning and I was very keen on going on a place where I was going to develop my skills and learn a lot in internship. And I think that someone told me at that time that the only way you're going to know is to actually contact an intern at that facility and ask them. Because like Cecile mentioned, that every department is different, even in the hospitals that I rotate in. So for example, with obstetrics, we had like ESMO-E training, which was really good. And our anesthetics department even makes us as interns do assessments and tests to make sure that we know what's happening. But our internal medicine department, if you didn't really, there was not one, there were barely tutorials or barely any lectures. And even surgery didn't have dedicated teaching time. So it does depend on which hospital you go to and which department. So rather speak to someone who's there and ask them exactly like, hey, did you guys get any teaching ward rounds? Do you get exposure to lectures and stuff like that? It obviously helps going to a place where there's students. So like here, the 5th year UKZN students come to rotate through Pietermaritzburg. So there are teaching ward rounds in quite a lot of the rotations. But obviously, if you're going to go somewhere where there aren't students, it might be less likely that you get exposure to teaching.
Yeah, and as much as you guys are saying how important learning is when you're in your internship, I think maintaining a work-life balance is also really important. So Francis, if you don't mind telling us how you keep sane and how you maintain that balance.
I don't know. To be honest, the work-life balance is very skewed. I can't lie. It's a constant struggle, and like most times you let, or I know like we let work get the better of that balance. I think trying to keep some kind of like hobbies and friends and stuff outside of medicine is helpful, so that you're not constantly surrounded by people who are only talking about medicine and like things that are only reminding you about medicine. Because I think we get a lot of that in med school. And so I think when you become an intern, like you spend your whole day at the hospital, like you need to be able to come home or on your days off or on the weekends, like you need to be able to switch off and not be dealing with work. In saying that, at Barra, we spend a lot of our time at work, and you know, days off are few and very far between. So yeah, if you're looking for a good work-life balance, going to big hospitals like Barra is not. It's just not what's gonna happen, I'm afraid. Like I don't want to be negative, but I also can't. I don't want to lie either. But I mean, it is rewarding most of the time, and you do learn a lot. And I live with the hope that like it'll come to an end, and at the end you'll be grateful for what you've learned. But yeah, work-life balance, that is not the place for that, I'm afraid.
Tinswala, would you like to add to that?
So when we initially moved to Livingston, I social compacted, and we got our first choice to come to Livingston, and we got welcomed into a group that had a social comm that had like a separate group called P-Easy. And this group wasn't just about sort of planning like nights out and stuff, but they had like rock climbing adventures and hikes and stuff arranged, so you could meet your seniors, mostly interns, but also some MOs and registrars would join. And they did like, in Bloom, we had a thing called Blow Bloom, where you get on a party bus and you sort of go around to different places and restaurants, whatever. And they did the same thing where registrars would come and join you. So that was really, really good. And the little breaks where we weren't on level 5 and like super restricted. So finding a good sort of community vibe, if that's what you're looking for, moving into a new city, I think that's something that you might want to consider and find out what hospitals sort of offer that.
Well, that sounds really, really nice to just kind of, separate your work and leisure life a bit and get to know everyone a bit better, especially if you're in a new city and a new province. In terms of your internship contract and if you, so obviously it's a 2-year program, the internship program, but is there by any chance any way, if let's say something happens in your life and you need to stop in the middle of 1 year, you need to move somewhere else, is there any way of getting around that? How does that contract work? Joe, you can go ahead.
So just the one thing that I've seen, because we've got our Judasa Telegram group with all the interns that applied last year. People to this day are still swapping out. So if you get someone from a different hospital that's willing to swap with you and you've covered the same rotations, then you can easily swap out and it doesn't affect you. But it's just a thing of finding someone who has done those rotations at a hospital that you like. That's the one way I know of. I don't know other ways.
Cecile?
I know from personal experience, like with my friends at the hospital, the first 3 months,
Cecile, if you don't mind, you are cutting off quite a bit, so I'm going to move on to Falak for now. That's okay.
Even if you don't stop, I mean, I don't know how it works 100%, but I know you can do it. If like something happens in your life and you need to take some time off, you just need to apply for it. And I know you can take like time off. The only thing is you then need to come and complete whatever rotation you took time off from. It either happens at the end of your first year if it's something that you can't move on without, or so you'll basically just be asynchronous. But you can take time off and come back and complete your internship, yeah.
So part of that contract, I understand, is having certain hours or certain months, however long it is, dedicated to certain departments. So some students are just wondering whether you can kind of manipulate that and work it according to what you need to do, or if that's set in stone, how many hours you need to spend in each department. Francis, you can go ahead.
So it is fixed by the HPCSA. So you spend in your first year, you spend 3 months in obstetrics and gynecology, you spend 3 months in pediatrics, 3 months in internal medicine and surgery, and that makes up your first year. And then in your second year, you do 6 months of family medicine, and then you do 2 months of orthopedics, 2 months of anesthetics, and 2 months of psychiatry. And part of your, I think it's the same everywhere, but I know for us, part of our family medicine rotation is you either work in the clinic for 3 months, and then you have a month of emergency department time where you just work in the emergency department, and then you have 2 months where you work in the secondary district hospitals, so like Lerotong and South Rand and places like that. But you don't get to choose at all how many hours or how much time you spend. It's fixed by the HPCSA.
Thank you so much. Cecile, I'm not sure if your connection is a bit better now, if we can try it out.
Yep. Can you hear me? No.
Yeah, it's not too great. We can move on to Joey then, I think.
Just further with regards to the time that you have to cover, within each of those rotations, you have to do a specific amount of overtime. And it's quite interesting. A large portion of our salary is based on overtime hours that you do. So if you don't meet that overtime for whatever reason, then a very large portion of your salary actually won't be paid out to you. And what was I going to say? Oh, someone else what I was going to say, sorry. Basically, that you're going to do your overtime within each field. But then in second year, when you're in the smaller rotations at our hospital, like in anesthetics, you'll do your overtime in either pediatrics, surgery, obs and gynae, or orthopedics. And that you have some choice about. So at the end of first year, this year, we apply to where we would like to do our overtime next year in the smaller rotations. And they'll try and allocate you to a department that you want to do overtime with.
Okay, that's really good to know. Thank you so much. So, Yashka, would you like to add something?
Sorry, that was a mistake. But I can just add to say that I think it's also different wherever you go as well, like you guys were saying, because our family med rotation is basically 6 months where we spend in the district hospital. 1 month is dedicated to another full month of peds and another full month of obs and gynae. And we also have a block where they send us to rural KZN. So the family med rotation, because it's only started now, like I think our year as second years, we're the first ones to go through 6 months of fam med. So each hospital is still finding its feet on where they want to send people. So it's likely to change. But that's also another thing you're going to have to chat to people. Whereas like also with us in anesthetics, we do our overtime in anesthetics and ICU time as well. So it's different wherever you go.
Cecile, it looks like your connection is a bit better now if you want to go ahead.
Is it working now?
Yeah.
Okay. So I just wanted to add also, like, there's difference between the hospitals, like for obstetrics and gynae. At Grooteskiel, you do 2 months of obstetrics and 1 month in gynae. I know at other hospitals it might be 6 weeks and then something else. So that also depends on the hospital you're at. But the rotations are fixed. So in pediatrics, we also do 2 months of general pediatrics, where it's 1 month in acute care and then 1 month in a specialty like endocrine or something like that, and then 1 month in neonates. So that also depends on the hospital that you go to.
Okay, going a bit deeper into your experiences, I don't really want to address this question to anyone in particular, but some of the students are wondering if you've ever had experiences of being belittled by senior staff, underestimated on your abilities, and if so, how did you deal with that? Joey, would you like to go ahead?
Sure. Yeah, I think starting the year with internal medicine in this hospital, and just as a side note, Paul Hospital, I thought it was a nice small little hospital, a small regional hospital, because that's what I always wanted. And then I got here, and it's one of the bigger small hospitals, if I can put it like that. It drains a very, very large portion of the whole West Coast. So it's in between your small hospitals and your tertiary hospitals. And your internal medicine, as I said, being on call by yourself at night, it does sound like you're on your own and you don't have supervision, but you actually do still have very good supervision. You always can phone someone, and then the next day, when you present all your post-call patients to the seniors, they really do go with it, go through every patient with you and really teach you. But it's also very, very, very high expectation. And you need to be on point all the time. And small little things if you miss, they will exploit to you for. It's the most thorough department I've ever come across in all my training years. But yeah, you can easily in a small hospital be targeted in a way. Okay, it sounds a bit dramatic, but you can easily be watched, can be called on, and people and the seniors let you know, okay, we're keeping an eye on you now because of something small. So you always have to be on your best game. You can't just disappear in a pool of interns, And there's only 5 or 6 interns per big rotation currently for us. And one of my colleagues, the most incredible person, had a mental breakdown and had to even be hospitalized in internal med, but purely just because of the victimization. It was so sad to see. It was so sad to see. And all of us, the interns, could see that he, for some reason, was being picked out. And it can really, 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 really just break a person. And it's so wonderful if you are the one that's liked for some reason, if you happen to be in the good books of your seniors, then it's great. But then you see people who really aren't, and people who are really, really trying, and I've seen that this year, and it's terrible. It's the hierarchy is still there. You need to fall into place, and some departments are different. And then everyone's like your family. It's interesting how you just never know what you're going to get into, and you need to be prepared, and you need to somehow be resilient. But it can be exhausting. Yeah.
So just based on what Joe said about having supervision and stuff, sometimes I feel like at Barra you get so much supervision. Like there are so many seniors on calling your seniors for help that sometimes you never really take your own decisions. And I feel like, but I'm sure it'll get better once you move to like second year and family med and once you're all alone and on call. But for now, there's so much senior supervision that sometimes you become more reliant on them than you probably should be. But it's just so easy. And because they're also registrars and they get crapped on if you screw up, some of them can be quite in your face and controlling about how you manage things. But just about, like Joe was saying, there were only 6. At Barra, there's so many interns. It's so easy to get lost in a pool of interns. Like you can do a whole rotation and the consultant might not even know your name. So it's quite easy to get lost in a pool of interns. And while you need to be on your game all the time, you can have colleagues that are super slacking. But because other colleagues pick up the pieces, nobody really ever realizes. And you can go months without anybody realizing that someone is actually not as good as they're supposed to be, or they're not learning to the level that they're supposed to be learning.
Cecile, would you like to add to that?
I just want to add something to like the whole victimization thing. It is dependent on the seniors that you're with. So unfortunately, like personally, I have been victimized by one of my registrars. She would not greet me in the mornings. You would be ignored throughout the day. You were called out like every single day, and it makes you feel awful. But the thing is, like, you go home and you make sure that you debrief with like your partner or with your friends or whoever is outside of medicine. And I think the most important thing is to realize that you are their colleague and you can talk to them. And definitely it did not help, but it's fine. I got to the next rotation and my new registrar was absolutely wonderful. Took us out for coffee, wanted to know all about us. So I think you just have to start realizing that it's not about you. You even like overhear them talking like, oh, they're so stressed for exams, so that's why they're taking it out on you. You just have to realize that it's not you personally. They're using interns as like a punching bag for their own stress, and it has nothing to do with you at all. And things get better, like you get a new registrar or you get a new like consultant, and then you just carry on. You forget about the other one and you forget about what happened with them.
Yeah, that's definitely quite nice that you get to be exposed to a lot of different people in a lot of different departments and meet a lot of people. That's really cool. Yashka, would you like to add?
I have a lot to say on this, but I'll try and summarize it. I do think that bullying and victimization and stuff is a huge problem that we have just in the medicine faculty, and it starts when we're students and it carries on, and even you'll see it happens to your MOs by their regis, it happens to the regis by consultants, and it kind of looks like there's never an end to it. So the one thing that someone told me that helped me a lot was in line with what Cecile says, is not to take it personally, because more often it says a lot more about the other person. And it sounds easier said than done, but it also helped me a lot when there was like someone who constantly was trying to like find flaws in my work. I was like, okay, I said to them, I want to be a good intern. So if you think that I'm not taking care of my patients, rather talk to me nicely and tell me what you want me to do, because we have the same goal at the end of the day. And then that person stepped back a little bit and was like, oh, okay. Obviously, it's not always going to go well. But I would say that if you can, try and address it with the person in a way of like, I'm an intern and I'm trying to learn, and I understand that maybe I made these mistakes. Would you be open to maybe helping me or giving me advice into how you think I can be better? Even if you think that they're just being extra, sometimes people want that like conversation with them, and then it might make your relationship with them a bit easier. The one big thing I do advocate for, though, is if you can see that someone else in your group is being victimized, like a lot of the times I feel like we also see that there's like racial things where you are picking on other people because of races, or like, undermining people or bullying them and stuff. It's important to speak out, and I think we need to be less afraid to stand up. Just because we're juniors and interns, we should still be able to say, look, I think you're treating this person unfairly just because of this, and this. Because at the end of the day, if that was you, you would also want other people to step in. So I think if you can find people in your internship group that are maybe a bit more vocal or more confident to go up, speak to them and say, look, I think that this person doesn't treat me well. What do you think? Do you observe the same thing? Should I go and speak to them? Do you think you can come and help me talk to them? And the other thing is that a lot of the times we're not aware that there's actually lots of systems in place to address these sorts of issues. So like, for example, if you work in a hospital, say in surgery where there's different departments, like a upper GI department and a lumps and bumps department and something, and you're having a problem in the upper GI department, go and approach maybe a reg or a consultant in the other department and say, look, this is the issue I'm having, but I still want to get my surgery exposure. Is there any chance that you guys have a space in your firm for me? And sometimes that actually works. You can switch firms and avoid the person who is bullying you. Obviously, if there was an answer to it, it wouldn't be happening anymore. It's a really sad reality, though. But I think trying to speak up against it is very important.
Yeah, that was definitely very helpful. I think you guys have raised important points about speaking up for yourselves and making connections with people, having conversations, so that issues like this can really get solved. One last quick question before I hand over to Sophie, who will chair the rest of the discussion. Some students who are watching the stream on YouTube are wondering what you guys were meaning in the initial parts of the talk when you talked about social compacting. If you can please elaborate on that quickly, and then I'll hand over to Sophie to conduct the rest of the conversation. Tinswalo.
So with your social compact, it seems like there are quite a few options. There's one for a partner or like a marital person, but there's also the option of compacting with like a friend who can basically be like a mental health buddy. That's the option that I chose, and if you sort of just apply to all the same places, you generally get the place that you want. That definitely happened for us and for a few other people. So that does increase your chances of getting placed together. I think it might be different for people who are married and sort of married outside of medicine, where your partner is not in the medical field and they're not getting placed for internship or ComServe. You might not sort of be placed in the same area as them, but it definitely does work well if you're both applying for internship, for example.
Thanks so much for clearing that up, Joey.
Yeah, so the kind of compact where you just want to be with a friend at the same hospital, it does reduce the amount of hospitals you can apply to. I don't think you can apply to any tertiary hospitals. There's a whole lot of restrictions with that. But if you want the smaller hospitals, then those are usually the ones that are left available to those who want to social compact. And quite a few of the compacts last year were actually split. But often one of the people would get one of the top choices. But many were very lucky to get.
Thank you so much, guys. I'll hand over to Sophie now, who will conduct the rest of the discussion.
in our own rotations for the majority of it. So even in internal medicine, you only do straightforward internal medicine, and then there's COVID units which are covered by the second year students in family medicine. They get pulled out from some of their family time to cover COVID wards. So that's been amazing. But then now with this third wave, they've pulled us out of surgery cores, so we don't do our night shifts in surgery anymore. We're doing it in COVID just because of the big wave here. But yeah, hectic, and I've heard my colleagues though that they're working in COVID much more.
Cecile?
So at Grooteskies it's much the same. Can you hear me?
Yes, we can.
So at Grooteskies it's much the same. Unfortunately, we do get pulled out of some rotations. So for pediatrics, we do get pulled out for a week at a time. It depends on if we're in the current wave or not. So we were pulled out in our last week of pediatrics when the third wave started, where the intern was supposed to go to the COVID wards. So unfortunately, you do get to lose a bit of exposure like that. And I just want to add with COVID, it's very emotional. You're very confronted with the severity of the wave. And I think that is something that you have to mentally prepare for. As interns, yes, we don't make the big decisions and everything, but you're the one who gets called for the recess. So I think just in terms of COVID, you have to prepare yourself to make sure that you're mentally ready and you think you can handle it emotionally.
Thank you, Cecile. I feel like you can go ahead.
Yeah, so at Barra, I've done OBS and PEDS, and I'm now in surgery. And thus far, we haven't been pulled out of anything to go and cover COVID wards yet. There's usually COVID MOs and COVID rages and stuff, so we haven't yet been pulled out to go. What COVID has impacted on, though, is it's completely eliminated all kind of teaching time, all touch things. So we were supposed to have obs and gynae touch once a week or something, and we were supposed to have some surgery M&M teaching thing. None of that really happens anymore. If it does happen, it all happens online, and because of the level of busy that we are, you don't really join those online things. You rather sit and do your work and that kind of thing. So no real teaching is happening because of COVID. And then also some of the units are very, very dwindled down. So anything that's not an emergency doesn't really happen anymore. And I feel like that's what you lose at a super academic hospital, because a lot of the stuff was elective, or it was the fancy, breast surgeries, the fancy plastic surgeries, and that kind of stuff doesn't happen anymore. So you lose that edge of why you came to a very specialized hospital, because all the specialist and elective stuff doesn't really happen anymore. But yeah, otherwise it hasn't really been that much of an impact, because we still do all the rotations the way we were meant to.
Okay, thank you very much. And this, sorry, we've just had one more of our interns join us. So we've been asking some questions, and we'd like you to just introduce yourself quickly. You're muted.
So sorry. Hi, everyone. My name is Wanga.
Write off things. I don't know about other people, but for me, a lot of how I enjoy the department depends on working hours and people who are there and how you get treated, and it's a lot of that impacts it, and less the actual patients. And so if you feel like you like something, think about it and think about trying it out at a different place, and you might actually like the specialty at one place and not the other.
Thank you very much. I'm not sure if it's Sinswalo or Wanga who wants to talk, but you can go ahead.
So I think, as Flak said, it's very sort of hospital dependent what experience you'll have in a specific department. But I think it's also just advice we got from a pediatric registrar was that you don't just choose the specialty that you're good at, but that you choose one that makes you a better person or a happy person to go back to. So I think, sometimes you might want to go for a really hectic sort of specialty program, but it might not be the thing that makes you happy and mentally stable and healthy. in specific departments. So just look at the department and how you feel when you're there and how it impacts the rest of your life. I think that's definitely an important consideration.
Yeah, I think that's a very good thing to think about is like if you've had your mindset on something for a long time and then something doesn't go so well, like it's worth considering that it might just be that hospital. I think that's a very good thing to remember. And so there are lots of fifth and sixth years who say that they can't really remember the work that they did in third and fourth year. And this person is just asking if you think that learning happens in fifth and sixth year, and that enough of what you learn in fifth and sixth year, or that you learn enough that you will be able to carry on into internship, or if there is any way to like continue the learning into fifth and sixth year. Jerry, you can go ahead.
I think it's really hard to continue the learning into the later years that you had in third and fourth year. And there's so much I wish I remembered from third and fourth year. And what I tell my friend Alyssa in third year is that she needs to make a file of certain key things that she learns in third and fourth year that is super, super, super skeleton summarized that will help her in the future. Because I wish I did that. Certain things like antibiotics and types of respiratory failure and those simple things that actually in internship you're like, look, okay, they're asking me about this. I have no idea. And then you don't know where to go and read it up on. Yes, you can go onto UpToDate and Medscape, but it's never really so perfectly nicely summarized. And yeah, if you flip and learn those antibiotics and do a bloody mind map of the antibiotics, and it will save you so much in your future. Like, try, I don't know if it's possible, but try think as you're going through third and fourth year, how can this be applicable one day when I'm in the clinical setting, and put those notes aside in a file for your, title that file for my future, basically, so that you can go back to certain things easily.
I like that, file for my future. That's really cool. Cecile, you can go.
I think you also just have to remind yourself, like, it's okay to forget things. Like, no intern knows as much as a sixth year student does. We forget things like no tomorrow. You have no idea.
Me, because also when I went to fifth year and sixth year, I was like, I'm pretty sure we had a lecture on that, and then I could not remember anything, maybe besides like the lecturer's face. So I think in third and fourth year, it's hard to conceptualize how it actually applies in a clinical setting. So when you're in third and fourth year, focus on the content and stuff like that, because there it's important to understand like the pathophysiology and basic physiology and anatomy, so that when it gets to more complicated things, you have the basics set and you can apply those concepts. What helped me in first and sixth year a lot is to take a condition, or say whichever block you're in. I'll use internal med, for example. So let's say we take neurology, and you take a specific condition. So what should we take? Like a the anatomy of the meninges. What was that like? Then I went on to what sorts of infections can happen. That I learned in third and fourth year. What am I supposed to learn in fifth and sixth year is how is the clinical presentation of this disease going to be? What investigation should I do to confirm it? And how am I then going to treat it? So in third and fourth year, it's okay if you're not, what treatment and investigations mean so much. Don't be like too hard on trying to focus on that.
Have time to just rehash all of that stuff again. So don't be like super hard on yourself.
That's definitely good to hear.
Yeah.
Jerry,
I just want to add, in light of
yeah,
that,
sure.
sorry. A lot of the times you think that like you don't have time to go back and sort of read at home, but you'll be sitting in ED with like a heart failure patient, unsure of what drugs to use, and you can just use Medscape at that time, or EM guidance. Those protocols are always available to you. So medicine is a lot of it is learning on the job. So the books are great to use at home and like just have that background knowledge of how diabetes, whatever happens. But when you get there, there are a lot of opportunities just to read or like find out from a senior what they use to manage a specific patient, with their like patient profile and their demographic and everything else. Yeah.
Okay, thank you, Tinswala. You can go, Jerry.
Yeah, definitely. And certain hospitals have protocols for their different rotations, which makes it much easier as well. For example, in surgery, by the end of week 1 of surgery, being at a regional hospital, you've seen every single OSCE topic that they told you is important. You're like, now it makes sense. You're literally coming in and seeing so many of all of that. And yeah, you're definitely learning so much on the job from day one.
That's definitely good to hear. Then, what is the average salary during internship? And are all interns paid the same? Does it make a difference what hospital you're at? And then there's a follow-on to that of like, is it fair for the working conditions? But can you guys just start with how much do you guys get paid? Francis, you can talk. Thank you.
So all interns do get paid the same. It's 42,000 a month. I know there is like a rural allowance if you go to a more rural hospital. I'm not 100% sure. I don't remember exactly what that is, but you get a rural allowance, and you also in certain places get housing allowances. And yeah, I'm not sure what the follow-up question was on whether
it was basically, is it fair for the amount of work you're doing?
So we get the 42,000 compromises a basic salary, which I don't remember what the exact figure is, but say for example it's 35,000 rand, and then we get fixed overtime. Where I am, we get fixed overtime of whatever the remainder is. I think it's like 9,000 rand or something. So if you do sit and work it out, and you like divide the amount of hours of overtime you do, and like how much money you get for it, like in my first rotation in Peds, we worked what our overtime like salary allowed us for. We worked those overtime hours in the first week, and then the rest of the month you basically like doing your overtime for free. But in saying that, it's not so much that I think we should be paid more necessarily. I think we're paid a really good salary, and as a starting salary in like your first year leaving varsity, it's a very decent salary compared to other professional like accountants and lawyers and stuff. But I think the key there is that like you need more people, so your hours are less, so that what you're being paid is fair. But that's obviously different between hospitals. I know like that is probably a unique experience as well. But yeah.
Thank you very much. Tinswala, you can go.
No, my hand's not raised.
Oh, okay. Jerry?
Just to make it sound even nicer, your salary is actually 57,000 rand. So I try and remember that, but then you get taxed like 15,000.
Thank you. So, what do you guys feel about job satisfaction, especially after having studied for like a very long time? And that's an interesting thing as well. Like, I haven't asked if any of you guys did the graduate program at WITS, or if you were all mainstream. That was one of the other questions. Tinswala, you can go. Sorry, you muted.
I actually want to add to the previous question. There are some hospitals where, so for example, we are based at Livingston, but we have to do work at UNIC Provincial for 6 months of family medicine, and that is about 30 kilometers out. So you are literally driving almost 2,000 kilometers a day, and that's not included into your salary, and that's a lot of petrol money. And sometimes maybe like if you don't have a car, you'll have to Uber or get lifts and stuff. So just keep that in mind when you are applying to a place that you might not have things included in your salary, that you have to sort of fork out extra. Sorry about that, yeah.
Yeah, no, thank you very much. So the question was on job satisfaction. How do you guys feel after having studied for 6 years? Jerry, you can go.
Amazing. I think it's so hectic and very, very, very daunting at times and whatnot. And as much as it can let you down, it's still worth every single moment. I did go through the GEM program and studied a total of 10 years at WITS.
Good to hear. Francis, you can go. So,
yeah, I think you can have like incredible job satisfaction, and you definitely have moments. Like if your entire week is trash, and then you have one moment on one call where you like completely like change someone's life, and you can see that, and they tell you that, and like it's the best feeling in the world. Like you won't, and you'll see when you go through it. Like you can't even describe it. Like I was like on a surgical ward call, which I don't know, people might not know, but like a barrier surgical ward call is probably the worst thing you'll ever do in your entire life. But I was on a ward call, and I went into a ward, and I was so busy, and I was so frantic, and I was so stressed, and I saw a patient who I had admitted on a previous call, and like he was on death's door, and I was the person who admitted him, and I saw him then like 2 weeks later in the ward, and he said to me, he heard my voice, and his eyes were closed, and he called my name, and he was like, "Dr. Chappell, is that you?" And he recognized me, and he said to me, he was like, you were there for me on the worst day of my life. Thank you so much. And to hear that, like, you can't, the feeling you can't describe. And it's definitely worth the 6 years of hard work. Yeah, you definitely get the satisfaction out of it.
Thank you, Francis. Yashka, did you want to say anything?
I was just gonna say that it is obviously very rewarding, and I think it does depend on who you are as a person. It is.
Like I didn't ever properly manage a patient myself. So when it comes to actually, okay, this is your patient. Okay, well, I suppose at the smaller hospital, they literally give you 14 beds, and those are your beds, and you manage them every day, and no one else. And you're around with a consultant once a day. Then it becomes very scary to fully manage. So if possible, in your fifth and sixth year, try somehow manage a patient fully.
Okay. It's very interesting that how different it is at all the different hospitals. Cecile, would you like to talk?
I think for me, like being able to run resources, like, yes, you have a senior all the time, but like at Gritsky for internal med, your reg leaves at 11. So from 11 onwards, you're alone and you run those resources. So I think it's very, very scary if you've only done like CPR and now suddenly you have to interpret that blood gas and you have to make sure that the patient doesn't die. So I think being able to like handle that stress and also just being able to run through the resource protocol and just make sure that you can fix the things that are correctable. Like, I think that's very scary and very important to learn. But like I said, you learn it on the job.
Yeah. What has been the hardest part of internship so far? Francis, you can go.
I think for me, the hardest part has definitely been the hours and the amount of time and energy that internship takes from you. Being at the hospital and doing your work, but also like you get super attached to your patients, and you put in a lot of effort to help them get better. And it's emotionally draining, it's physically draining, it's mentally draining. Whereas like when you're a student, a lot of it is like mental drain from like studying and stuff, whereas I found that internship's a lot more physical and like emotional drain, and it's a big shift to all of a sudden like you get to know these people. As a student, you come, you clerk them, you present them, you leave, you go to your TAT or whatever. Like when you're spending all day in the wards with patients and you get to know them, you get to know their families, you meet them when it's visiting hours, whatever else, like that also takes away from like it's those hours as well that are spent when you're at home worrying about that patient, like oh, I hope they don't decompensate in the night, or I hope somebody remembered to hang that bag of ringers, or like whatever silly thing it is. It's those hours that you take away from the hospital as well has also been one of the hardest things for me personally to deal with.
Thank you for sharing. Yashka?
So for me, I think the hardest part has been when the system works against you, attached to your patients and things like that. And then when the system is not allowing you to help them and you're just frustrated and you know that there's really nothing you can do about it in that situation. That's something I still up to today have a problem with. Even today, I had a fight with the lab because they just would not be processing blood results, and it is so hard to deal with those things. And I think also the other thing that we minimize is being exposed to death, a lot of death, which is something everyone talks about, and we're all like, yes, we get desensitized and stuff, but it doesn't get easier, I think, as much as you go through it. Well, for me at least.
Thank you, Yashka. Joey, you can go.
From a practical point of view, I think it was the first few weeks of internship that were the most difficult, just because of the transition and adaptation, and that's normal. But on a more the most difficult thing was following on what Yashka said, is I think allowing time to grieve. Very difficult, because you will be involved with a resuscitation of a severely malnourished little baby that you can see has just been neglected completely. You'll be doing that CPR on this tiny thing in the resus room, and you will know that at the end of these 20 minutes, the baby's going to be dead, and you're going to break it to a mother who doesn't really seem to care, or if it's a mother that completely is going to scream her heart out, and you'll go to sleep with those piercing screams in your mind. What I find very difficult is to allow time for emotion, because the moment it's done, there's another thing you have to get to immediately. Okay, baby's dead, tell the mother, quickly go and take the blood gas on the child fitting upstairs, and it's just go. And by the end of it, you finish with your 26-hour shift or whatever, and then you just sleep, and then it's the next day. And what I've started doing is forcing myself to, on that little walk from downstairs after the resus to upstairs, to cry. Because you're so, it's so intense initially, and it's so easy to become numb to it, and just be like, okay, it's another death. But since I've started forcing myself to allow myself to feel it as quickly as possible in that moment, and then let it be over by the time you're at your next patient, it's so cathartic and therapeutic. And it's like you give, even if it's just 1 minute, to mourn this life that you've just been working so hard to save.
Yeah, I think that's a very interesting perspective. Thank you. Cecile?
I think, like you said, it's so difficult to have this patience and then listen. And I think what no one prepares you for internship is, yes, we have one lecture on how to break bad news, but ever told you how to call a family member at 2:00 in the morning and tell them that their family member has died? I don't think that's something that you can prepare for. It's something that happens so often. Every single call it will happen, and you will phone the family, and sometimes you don't even know the patient, but you have to tell this family member that this has happened. So I think it's just very important to check in on yourself. Like Joey said, it's so easy to become desensitized to this, but you also have to remember that you're calling someone's family member. So you can't just be like, this is something that's happened, let me quickly tick it off my list, call the family, okay, your husband is dead, let's move on. I think you have to really internalize to the point where it upsets you so much that you can't cope. But you just have to make sure that you acknowledge the life that you are trying to save, or that you just have to make sure that you keep checking in on yourself, and that there's everything that is not easy. So better just stick together and help you through these times.
Thank you, Cecile. And another thing that someone would like to know is what a normal day looks like for you guys. So I know that a lot of people are always asking about the length of time of your actual calls, and Joey mentioned the 26-hour. But what does a normal day look like for you guys? Cecile, I'm not sure if you're trying to talk, but you're unmuted. You can go, Cecile.
I'm trying to talk.
Oh, okay. Francis, you can go ahead.
So I think it's a difficult question to answer, because it's very different depending on the unit, but what rotation you're in. But in terms of calls, that's also obviously dependent on the unit you're in. But like for peds, for example, your calls are broken up, so you never do a full 24-hour shift. Unless you're neonates, for your month of neonates, you do like 24-hour shifts, and then on the weekends you often end up doing 32-hour shifts, 7:30 or 6:30 until 4:30, 5:30. Like that's just general. Some days are earlier, some days are later, but yeah, that's the most common time frame.
Thank you. And then, do you guys think that internship needs to be 2 years, or do you think that you would be able to finish it in 1 year? Like, just as a kind of hypothetical. So definitely 2. Okay, thank you. And then, are there any allowances for people who are not South African citizens to be able to get into the internship program? Yashka, you can go.
So this is actually a really sad thing at the moment, because I'm sure a lot of the other people know, but the way the placements work is that they place South African citizens who studied in South Africa first. Then it is the Nelson Mandela, Fidel Castro people, so that is South Africans who were sent to Cuba to study. Then it is South Africans who studied overseas, and then it is foreign nationals who studied in South Africa. So my clinical partner, for example, still has not been placed for internship, whereas I'm now in my last 6 months of internship. And unfortunately, the HPCSA doesn't really give you much help when they've been, trying to fight and find placement for it. So non-South African citizens are currently, a lot of them, struggling to be placed. The website doesn't even open up applications for them. They don't even get to apply some of the times unless they have permanent residency or things like that. So permanent residents do get placements, but also a lot later than South African citizens. There's not really been an answer. I mean, Carte Blanche has interviewed people about it. Most of the time they only get placed maybe 3 or 4 years after they graduate. So that's as much as I know about it.
Thank you very much. Okay, so we've got to the end of our talk now. Thank you guys so much for participating. It has been really, really amazing. Just one more thing before we end is I'm going to share my screen and I'm going to do the draw for this pair of Patsock scrubs. But thank you so much to our panel. You have been really, really amazing, and I'm so glad that you guys could join us today.
Thank you for having us.
Oh no. Just realized that I actually want to do this quickly. Okay, cool. So here we go. I've got my thing with the wheel, and as you can see, there's 168 inputs. This is fair. It's got everybody who RSVP'd. I'm not doing anything biased, and I'm going to start it now. go. So it's going to be Chloe Peterson. So we will email you when this is all done. And thank you very much, everyone, for joining. So that brings us to the end. Thank you very, very much. And that's the end of the meeting. Thank you. Bye.